Everyone ready to begin?
Yes.
All right. Why don't I call this public meeting to order? Today, Thursday, January 27th, 2022, 4 p.m., albeit about 4:02. This is a meeting of the Board of Health. The first item on our agenda is a hearing. We actually have 4 hearings, I think it is. Why don't we start with the 4 o'clock hearing? I'll call that to order now. Notice of a hearing. The Peabody Board of Health will conduct a virtual public hearing on Thursday, January 27th, 2022 at 4 p.m., that's right now, at the request of Ryan Silaba regarding the correction order and fine issued on December 14th, 2021 for violations of the regulation of the Peabody Board of Health restricting the sale of tobacco products, an act to modernize tobacco control, and 105 CMR 665.000 at 711 23 Newberry Street in Peabody. A vote will be taken to uphold, modify, suspend, or revoke the correction order and associated penalties. Is someone here from staff? I see Randy Suckney. Inspector Randy, could you give us a briefing on this issue? I think you're still muted.
So I was conducting a routine inspection of the establishment on December 14th, and I noticed they were selling flavored Delta 8 vape products, which, as we know from past experience, is not allowed because it's a flavored vapable item, and Delta 8, considered by Massachusetts law, is not is considered a controlled substance in the state of Massachusetts. So that was just a regular routine food and tobacco inspection, and that's when I noticed those items at the store.
Okay. Do any of the board members have any questions for Inspector Randy?
I have one quick. Oh, sorry, Doctor.
All right.
Randy, I saw on this, it's a 7-Eleven. Is this the only 7-Eleven in Peabody, or do we have several?
Right now, we have 3 left.
3 left, okay. I'll save my questions later. I just wanted to see that.
Eventually, there will be a 4th because they just purchased Speedway.
Okay. Thanks, Randy.
Dr. Julia, did you have a question? Nope. Okay. All right. Well, thank you for that, Randy. Anything else to offer? Sharon, or I see Joyce on the call. Joyce, is there something you could add for the board on this?
The only thing I can add, and this is, I don't know what I wasn't there at the time of the inspection, but this Delta 8 product has come up across the collaborative. And in fact, on January 6th, there was a very similar meeting where the retailer suggested that these aren't flavors. And I do have a copy of the manufacturer's letter. I just sent it to Sharon and to Randy very last minute. I apologize. But the company, their basic letter attests that this doesn't fall under CMR 665.010. And basically because their claim is that it's not a tobacco product, which in fact, if you look at the regulation at the state level, they describe tobacco products in their definition as being anything vapable. It's not just tobacco, not just nicotine. If it's not FDA approved, if it's a flavor, it's against state law. And to suggest that these aren't flavors, which I think someone suggested that they were strands of hemp. The letter that I have says the brand is Cake Delta 8, and the strains are names like Blueberry Cookie, Cereal Milk, Hippie Crasher, Animal Cookie, Banana something, and our argument has been all along that we're not a lab, and if it's clearly stated that it's a flavor on the product labeling, we too are going to assume that it's a flavor. And I think that their argument is only that we didn't have jurisdiction over this. Now, as far as the Class A, that this is a Class A substance because it's a synthetic derivative of hemp, which the Farm Bill does not make exception for. State law specifically says it can't be processed or sold in Massachusetts. And we don't have the jurisdiction to enforce that portion of it. That would go to the police department to just get it out of the establishment. But we do have, under the tobacco law, under the state law, we do have the jurisdiction to, enforce on this because it's a flavored vapable product.
Okay. All right. Thank you. Well, we've heard that. Is Ryan Silaba on the call? Ryan?
Yes, I'm here. I'm here, Ryan Saliba.
Oh, very good. Thank you for joining us.
Thank you.
What can you tell us about this?
I have been I'm the first and only owner of that store since it opened in 2002. And about 6 years ago, I had 2 violations within 1 year. I fired my manager and I brought Carlos, the current manager, from another store because I know he goes by the book. And what happened right now is to put it best, is we got duped by the vendor because he came into the store. He said, this is legal. He said, showed us some paperwork. He showed us some a website. And he said, this is legal to sell. And we offered it. Let me tell you this. That product sells for about, I don't know, $20, $30. And we sold like within 3 months or 2 months, whatever it is, maybe 1 or 2 pieces. So I know some people are trying to bend the law and sell illegal stuff in their stores everywhere because they want to make the money. But from a franchisee's point of view with 7-Eleven, where we split the profits 50-50, does anybody honestly think I'm going to risk making $20 or $30 a month, of which 7-Eleven will take 50%, and risk all my reputation with 7-Eleven and risk the penalty, 7-day suspension, my reputation with 7-Eleven just for $20? And not only that, if I get suspended for 7 days, 7-Eleven is going to estimate how much money they lost in those 7 days from the sale of tobacco, and they are going to make me pay for that as well. Does anybody honestly think that I'm going to risk all this money just for $20 or $30 a month, of which 7-Eleven takes 50%? I think that was an honest mistake on our part, that we got duped by the vendor. And when the violation happened, Randy was at the store and Carlos called the vendor right away. And Randy can attest to this, that he spoke with the vendor personally. And the vendor said, oh no, this is legal. I'm putting it in a lot of stores. It's completely legal, and so on. So I don't know what to say anymore. We didn't do this on purpose. And I believe we got duped. And I don't think it's fair for me to pay the $1,000 or get suspended for 7 days, because it's going to cost me a lot of money for an innocent mistake.
Okay, thank you for that. Do any board members have any questions for Ryan? No? Is there anything further that we should hear?
There is somebody else with their hand raised. I'm going to.
Yeah, I think that's Carlos, the manager. He might have joined.
All right. Thank you, Sharon.
Hello.
Hi, Carlos. What can you tell us?
All I can say is that Ryan explained a lot of it. This vendor, we've been dealing with him for years prior to the ban of any flavor, any vape product. So he's the one that comes in and say, this one you can sell, this one you cannot sell. So we went by him ever since any ban has started on any vape product. So we assume by him saying that, we're good, because there's item I'll ask him, customer will ask for it. He'll be like, no, you can't sell that. I won't give it to you. So I went by what the vendors say. I know they're in business to make money, but on previous experience with this particular vendor, that he's one of the biggest supplier of any vape product, he refused to sell. Like if I ask him, he'd be like, "No, this you cannot sell." Okay, I'm all set. I don't need it. That's how we were going along since the ban had started. And Randy can witness that I called him and he said he's been delivering it to everywhere in Massachusetts. That's the first time he's ever heard of it. So the lack of information that we had, a new law popped up. I didn't know. And regarding the flavor, this is not a flavor. He said there's a QR code on it, and I scanned it in front of the Randy and showed that this is the strain. Maybe it's misleading, but he told me that this vape does not fall under the tobacco and the vape law because it has no nicotine. And I was not aware of all that. I've been doing this for 17 years with Ryan. I drive 30 miles away from my house now. I used to work 1 mile away from my house to come and straight this place up when he lost his license. I will not risk my job, my boss's job that he's like family to me, that I've been with him for 17 years, over very small profitable item. And if I had something to hide, won't be posted in the front of the store on the front counter I have nothing to hide. So everything is by the book we do here, nothing to hide. So why would I have it up front knowing that Randy could come anytime or anybody? We don't do that game. We try to sleep at night good with no worries. That's all I have to say. I've been doing this. I've never once in 17 years been fined for underage selling or for any violation of any sort of with any town I worked with. I just would like to clear that in mind. And I would not risk the franchise for my boss that I've been with him for 17 years of a very low profit or high profit. I would not risk that. I support a family from this job, so is he. So I will not put my source of income on the line for over something very small if it was intentional.
All right, thank you, Carlos. Thank you for that. Is there anything else we can hear? Randy, did I see your hand up?
Yes, sir. So back in November 21st, 2019, they were fined $100 for a flavor violation under the under the local regulation, which is why it was bumped up to a first state violation that went to $1,000, but second tobacco violations, which carried the 7-day suspension as well. So they were fined in November of 2019 for flavored violations of combustible tobaccos.
Okay.
Sorry.
Sharon, I see Ryan's hand up and I see Carlos's hand up. I guess they'd like to say something additionally. So we'll hear that. Ryan, why don't you go first?
Okay. That was an oversight on our side. Unfortunately, that is a kind of cigars that are packaged in a box just like cigarettes, and it was put with the cigarettes at the time. And then when the ban and when the price change happened, we did not see it. I mean, it was an oversight on our side. We were selling it on for $3 instead of $5. That's the only thing about that. It was just an oversight on our side.
Oh, okay.
It was not intentional or anything. It was a cigar that's packaged exactly like a pack of cigarettes. And
all right.
Was put with the cigarettes.
Understood. Thank you for that clarification. Carlos, what would you like to add?
So Ryan added already.
Okay. All right. Very good. Randy, go ahead.
Sorry to go back and forth, but according to my notes, the violation was for selling Jazz and Blue cigars. It wasn't a pricing violation. It was actually a concept flavor violation at that time.
Okay. Gentlemen, I'd ask you if you want to refute what Randy's saying, we'll listen. If you just want to confirm it, that doesn't help a whole lot.
No, that's
no.
Sorry. That was sorry. Randy, you remember that after you cited us with that, you gave me the list that I'm allowed to sell. And at the time, that was not, sorry, can you hear me?
Yes, I can hear you, Ryan. Go ahead.
At the time, there was nothing written on that particular item, was colored. But somehow only this town, which is Mr. Randy, said that don't fall in that category. In every other town that had the same exact flavor ban, we were selling it, and there was not flavor. There was somewhere in the fine print, it wasn't even there. That's why. And after you cited us, since it was $100 first violation, I didn't make a big deal out of it. We took the fine and you gave me the list of what I'm allowed. I did not have the list. I was only getting a list from vendors. I did not have the list from you that allows me to know what's going on. And that was a technicality. And they've been there before. Joyce been more than once to my store, and she knows she's never had any complaint about my what I have to do. And matter of fact, Joyce was there on the Sunday before you came in. While no one was there, they called me from the store. I said, she's there, and I spoke to her, and she knows me that I've been there forever, and I've never had a violation with her. So that was a technicality again. So twice wasn't a violation intended or trying for more profit, was technicality issue. So from now on, we spoke me and Randy that any new item that we got, tobacco or anything, I will bother him and call him and ask him, can I carry that? He's gonna say yes or no. We agree on that on the store when he was here, because I'm falling through the crack of the technicality, and I honestly, it's not fair to so many laws in the state, so many laws in this town that we are confused as a retailer. So please, just if it's technicality, just use your fairness, Tojas. And from now on, any new item will ever we take into the store, we will call Randy prior to get his approval, if that's fair enough for you guys.
Yeah, so you said, Ryan, we heard
Yeah,
you.
I'm sorry. Yeah, that was Carlos explaining.
sorry,
that.
Carlos.
This is
Okay.
Ryan now.
It's fine. It's fine.
My explanation earlier. Obviously, I got confused with the first violation. I thought 2 years ago it was a price issue. Obviously, I was mistaken. I apologize for that. But Carlos explained to it what it was. Obviously, at that point, because it was like just $100 and the small oversights, the small technicality, as Carlos said, I said, you know what? Okay, pay the $100. Carlos, pay the $100, and let's move on. So obviously, I misunderstood that first violation, and I apologize for that.
Okay. Thank you, Ryan, and thank you, Carlos, for all of the clarification. Do any board members have any questions? I see Joyce's hand up. Joyce, would you like to add something to this?
Just quickly, because although I always say they can call the Board of Health or myself, it's not our job to go through every single line item in a store. And I know that we're a good first line of defense, or maybe a second line of defense, but their very first is a simple Google search. And the burden, unfortunately, is on those retailers to know what they're selling. And so I would just say, I'm here. I always offer myself as a phone call away, but I can imagine the next, not necessarily with 7-Eleven, but the next Board of Health hearing about not being able to get a hold of Randy because, God forbid, he's on vacation and we couldn't tell him explicitly whether or not this was a product they should sell. So I just want to say the burden should not be on the Board of Health to make that decision or delineation. We're here as a help, but they need to know what they're selling in their establishments.
Very good. Thank you, Joyce. All
yeah,
right.
I understand what Joyce is saying. We're in no way putting the burden on the health department. It's just Randy. He's the one who suggested to call them, and he offered, and we are pleased that he did. The point I'm trying to make here is we have thousands of items in store and hundreds of tobacco. And I know the liability falls on us to check every single item. But sometimes, as we said before, when you've been dealing with a vendor for years and years, and you know that you trust this vendor and he comes in and gives you a product, maybe we let our guard down a little bit. And from now on, we know better. So as Randy suggested, we can call the health department. Is Randy on vacation? We won't even introduce the product until Randy comes back or whoever comes back. Or maybe you can Google it. I mean, we didn't know these technicalities. We did not know these procedures before, to be honest with you, because so many rules, so many laws about so many things. But now we learned how to go forward, and I hope you use your fairness and dismiss this case. Okay,
thank you once again, Ryan. Do any board members have any questions? No. Let me say this. Ryan and Carlos, you both seem quite credible with your intentions to not violate the law and to not sell these products. And it's clear to me, at least Ryan made it pretty clear, economically, it doesn't make sense either, right? Put yourself at risk, put your franchise at risk. And the burdens of the $1,000 in the 7 days where you're going to have to receive the estimate from 7-Eleven, I understand that that's burdensome. But for me, this isn't so much about your intention. You both seem like honorable businessmen. It's that there was a violation. And while you may describe it as a technicality, it is still nonetheless a violation. You know, and these laws and these regulations are in place to protect public health. And there needs to be some method and some level of enforcement for these. So I just offer that and wonder what the board is thinking. Any comments? Is there anything else? If not, I'll close the hearing. Sharon, is there anybody else who wishes to speak on this matter, either in favor or against any kind of action we may take? You see anybody?
I don't see any hands raised, but if anybody would like to speak on this, now is the time. Please raise your hand.
This is a public hearing. We want to be sure everyone's being heard.
I don't see any hands.
Okay. All right. Well, I'll close the public hearing. We'll end comment there and ask the board what's their pleasure.
So I completely agree with you, Tom, and we've talked about this before, and specifically about the flavored tobacco and or the flavored products and their attractiveness to young people, and the reason for the stringent laws on this. So, you know, the fine as well as the 7-day suspension does seem like a significant burden to the establishment. And I also don't want to take away from the seriousness of these products and how and that, you know, in Peabody, that we want to be very deliberate in how we handle this.
We have, if I can interrupt you, Doctor, we have in some cases, given some mitigating circumstances, held the fine and the suspension in abeyance. And I'm not necessarily opposed to that, but if we do that, I think that I would almost insist that the record reflects that this is the first offense and that the second time would be at the second level.
So the second time,
I'd ask Joyce to remind us what the violation for the second is, but I think it's 30 days. Is it, Joyce?
oh,
No, it would be a $2,000 fine. Well, right now we're looking at the state level. You guys are fining him as a first violation, but because of the former violation, which wasn't a state law, you're talking about a 7-day suspension. So if you were moving forward, let's say there was a sale to a minor or a flavor or any of the state law, it would bump the violation up to 5,000. I mean, I'm sorry, 2,000. But it would be their third violation. So it would go to a 30-day.
Yes. All right. So as I understand it, Dr. Joyce and Tony, if we were to hold this in abeyance and there was another violation, that it would be $2,000 in 30 days. I don't know how you feel about that.
I would be in favor of doing something like that. A little bit of apprehension with that is from, you know, previous meetings when we've done some things like this and we've had people back here for violations. They've actually used our decisions in those cases almost against us. And that's my apprehension with this. Again, I think both the manager and the owner have represented themselves today in I definitely understand the financial ramifications of a 7-day suspension. And as far as it being a franchise as well, there's other issues there. But like I said, my apprehension is that could this be used against us in another similar case? And we saw that last month, honestly.
Indeed, we did. I may even ask Ryan, you're hearing this deliberation now, what we're considering. Mindful that this meeting's being recorded and that your comments are going to be transcribed into the minutes. Do you understand that if we were to hold this in abeyance, that if there were a subsequent violation, that it would go to $2,000 and 30 days suspension?
Yes, I do.
And is that
I
something you
understand
think?
that, yes.
And you think that that's something that you could accept?
Yeah, it's something I can accept at this point, yes.
All right. Because you're confident, are you, Ryan? And I'll ask this to Carlos, that this isn't going to happen again.
Well, I hope not. And Carlos, if it ever happens again, Carlos' job is on the line at that point.
Okay.
So he's going to do his best to make sure that train everybody and to make sure that no further violations are happening.
Okay. These are serious violations. I mean, the
Yes,
penalties
they are. I understand.
aren't they?
They are definitely serious violations. I understand that.
Okay. All right.
Mr. Chairman, it's Joyce.
Yeah, Joyce.
I would just remind the board that we've had other retailers, and this is in no reflection on 7-Eleven, but as you indicated, these are on the record. And, you know, if another establishment comes before us at any time with a first violation or, you know, making a promise that they'll not be back the next month and the next month, as we've seen in this board prior. I'm just concerned that this may become a precedence for the city, not for this establishment, but rather how it's looked upon from other retailers within the city.
Well, yeah, you know, you bring up a good point, and that the responsibility of deliberating on these violations, because each one is unique, you know, falls on us. And I imagine that there will be times when there will be first violations that don't seem to have what appear to be some mitigating circumstance and require some measure of understanding, that we'll have to, you know, find a way to describe this one different from others. And it's difficult. It would be very easy to see all of this in black and white, you know, but unfortunately it isn't. And it's incumbent on the three of us to make these kinds of judgment decisions.
Yeah, I
hold on, Ryan.
I agree with this. As you said, each situation is
Ryan,
different. Yes.
Ryan, can I interrupt you? The hearing's closed. We'll call on you for comments, all right?
I'm sorry, I didn't know that.
All right. Yep.
Sorry.
That's all right. Mindful of the peril of making these qualifying decisions when these matters come up, what do you both think about that?
I don't know. I think it's a tough situation that if we do bend on this, because I just, you know, last month it happened. It's happened before, and managers and owners have come to us, and most times their defense is that they didn't know, or that they, you know, they weren't doing this in a malicious manner. And we're not here to whether to say it was malicious or intentional in any way. But I think, you know, ignorance of the law doesn't give them the right to not know that law in their industry. But like I said, that's my apprehension on altering this in any way. But you know, I'll defer to you two folks for input as well.
You make a good point.
And I think Joyce really hit the nail on the head, where this could be a very slippery slope as far as and we have these every month, pretty much every month on the agenda, that, you know, you did it for one, you're going to do it for all, or we're going to have to explain why each one is different in our mind. The laws are there for a reason. The fines are there for a reason. Although, they could seem extreme in some ways, we have to remember why we're actually enforcing these as well.
Yes, we do. All right. Well, then I'll state that I'm in favor of imposing and upholding the violation.
I second that.
All right, let me ask for a motion first. Dr. Giulio, Tony, do you want to put that in the motion to uphold?
Yeah, I'll make a motion to uphold the violation, the first violation for the state at $1,000 7-day suspension for 23 Newberry Street.
Okay. Dr. Giulio, you want to second that, do you?
Sorry, so I actually, can we just take a step back for a second? Sorry.
Sure. Sure.
Sorry. So is there, this is tricky. The 7-day suspension seems like it would be a significant burden. I do think that so I'm wondering if we can fine them and put the suspension in abeyance.
Well, I'm willing to consider that too. We haven't done that before that I can recall.
Okay.
Sharon,
So
do you think that that's something that we might try?
The language of the regulation has the wording shall, but at the same time, I think we're in a little bit of a gray area where we had, well, not really a gray area, but we're in a time where we had some local requirements that became state requirements. And so now we've got, a situation where we've got a first violation under state law, a second violation under local law. I do want to say I am concerned to hear, and we hear this time and time again when we bring retailers before us, and we very often hear, well, my distributor told me I could sell it, so I sold it. And what I think it's a very common theme for us to hear a lack of the permit holder to take responsibility for understanding and actively affirming that they have knowledge of the products they're offering in the store. So I will say that concerns me. I do think that because of, the state law and, the lack of things being in sync at the time, that maybe an appropriate middle ground would be to uphold the fine. And I do think it is important to have a suspension. I would recommend, if you are looking to hold the suspension in abeyance, you consider imposing a portion of the suspension and hold the remainder of the suspension in abeyance. I think it's very important because as Chief Carley had pointed out, when we exercised flexibility in the past, that was later used to say that the board didn't think it was serious and didn't convey to the retailer that we thought it was serious enough to uphold the penalty. So I do think it's important to uphold both a fine and a suspension, but I think the length of the suspension could be negotiated.
No, I appreciate that, Sharon. And I think, after hearing what you're saying, and I think I'm comfortable in seconding that motion. So we can uphold the penalty as it's written. So I second that motion.
All right, thank you for the second. We have a motion to uphold the $1,000 and the 7-day suspension. We've had a motion and second. Is there any further debate or discussion on the motion? Any further comments board members might have? No? Okay, I'll call for a vote. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. The penalty is upheld. To Ryan and Carlos, we wish you well. We don't quarrel with your intention, but this is something we think we have to do in the greater scheme of protecting the public health of the citizens of Peabody, okay? And we wish you well. Okay, let's move on to the next hearing.
In terms of process, if we could per minute, Ryan and Carlos, so typically what we have done is we have allowed the retailer to propose a date to begin to serve the suspension. It needs to be, we have a little bit of flexibility, but sometime over the course of the next 3 weeks, if you want to get back to the inspector, Randy, tomorrow with a proposed date to start serving that suspension anytime within the next 3 weeks.
Okay.
Then we will formalize that in a letter. We will, you will be required to remove all the product from the store and not be able to return it until after the suspension is served. But please connect with Randy by tomorrow and give him that date.
Okay.
Thank you.
Goodbye.
Yeah.
On our agenda is a hearing that was scheduled for 7:10 at the request of James Motzkin. Sharon, do I have it right that that request has been withdrawn?
That is correct. They've indicated their intention to pay that fine.
All right, then we're free to move on to the 4:15 hearing, are we? All right, let me call that. The Peabody Board of Health will conduct a virtual public hearing on Thursday, January 27th, 2022 at 4:15, albeit 4:38, to review and vote on the application for permit to operate a body tattooing establishment at 3 Bourbon Street. This was submitted by Sean McCarron. Sean, are you here? I see your tile. I see the mute icon. Sean, we'll give you a minute to get adjusted.
Hello.
Welcome, Sean. Thanks for joining us.
Hi, everyone. Good evening.
Good evening.
Good evening.
We're here to review and vote on your application. Could you just give us a brief introduction as to why you're applying?
Absolutely. I saw the opportunity for the build out already being done, and it was a good business opportunity for me to branch out and get myself a little bit closer to home. Also, I do own a business, similar business in Cambridge, which I commute to every day from Topsfield. So having a business in that area would be beneficial to me and my family, obviously. A little less travel, and I'd be home a little bit more time to time. Also, just I think that the setup was great for me. It was a little bit smaller than my place here in Cambridge. The price range for the lease seemed fair. I like the community. I like the area. I actually frequent a lot of things in the Bourbon Street area. And my wife is actually a nurse in Peabody also. So we kind of fond of the area, and I thought it would be a good opportunity.
Oh, very good. Who from the health department is here to tell us about this? Is Inspector John on?
Unfortunately, John is not here today, but he did let me know that he has inspected the facility and that it does meet all the requirements.
Oh, very good. Do
Me and
any
John had a walkthrough on Monday, and he was really pleased with everything. And I was glad to meet with him and show him around and show him the improvements and things like that they had made.
Well, very good, Sean. Do any board members have any questions for Sean?
If I could add, John also mentioned to me many of the tattoo applicants that have come before us in the past few years have used fully disposable instruments, but Sean is using kind of the old, the traditional approach, I guess I will say, and has an autoclave. And John has reviewed his procedures for cleaning and disinfecting the equipment and found them to be satisfactory.
Oh, very good. That's interesting. Okay. Any comments from members?
Just one quick question, and this is more for Sharon, but with Sean starting here, does he have to issue something like for him to be an artist there, or does this cover for him to operate the establishment? I know we see applications where they have, their applications with their vaccinations and things like that. Do we have that as well tonight or no?
No, we don't. He has not yet applied to be a practitioner in Peabody. He,
Okay.
I believe, wanted to get the establishment permit first. So, you know, if you were to grant this permit tonight, at the current time, there are no practitioners who are permitted to operate out of there.
Okay, great, thanks.
May I ask, Sean, Dr. Julia, please go ahead.
So Sean, I guess I am a little bit curious. I didn't think that people were using autoclaves and reusing the equipment as such. Could you just tell me a little bit more about that and the decision to operate that way?
Well, the situation is that some people do and some people don't. I have employees here in my shop in Cambridge that use completely disposable grips or tips. I personally use something that's a little more durable and has a more of a balanced weight. And it's a 316. It's stainless steel. These things are processed here, and then they're autoclaved. You know, we sport test weekly here in Cambridge, and there's really not much to it. Really, it's just it's for me personally, it's less waste. It's more affordability and a better I feel I deliver a better product using something that's more well built.
Okay. Thank you.
You're welcome.
Very good. My question, Sean, was do you intend to apply for a permit to practice
I do.
in Peabody? Okay.
I
Very
do.
good.
I've been tattooing in Cambridge license for over 20 years. Owned this shop here since 2002. Never had any issues or problems, luckily, knock on wood. I don't foresee any either. It's been really good for us. I mean, as a group here, and now we have an option that I have some employees that do travel from the North Shore area all the way to Cambridge also that would like to branch out and work with me up in that area. They're from Danvers as well, from Topsfield. So I mean, it made good sense to me.
Okay.
Yeah.
All right. Very well. Sharon, so we can be sure all the paperwork's in order for this anyway.
Yes.
Okay.
Yep.
All right.
Could I ask Sean to comment on what COVID safety protocols you'll be implementing in the shop?
Mhm.
So I don't know if you can see me, but I do wear a mask here in my shop constantly. All my employees do as well. We don't have any contact with any customers at all without a mask because that's the rule in Cambridge. We do have some people that prefer probably not to, but I mean, for now, it's typical PPE, regular protocol. Everyone that comes into our shop is immediately asked to use hand sanitizer. We ask them, about questionnaire quickly, just or think that they may. We do keep a temperature gun here that I scan people. The accuracy on those is, give or take a degree or so here and there, I've noticed. But other than that, it's, normal universal protocol here. I mean, we operate very much like a dentist. I mean, everything is, wash in, wash out, gloves off, gloves on, masks are on constantly. We barrier control everything that we use. Everything's single use. I mean, pretty much the routine here.
Okay. Is there anyone else who wishes to speak either in favor or in opposition to this application? This is a public hearing. This is the time to be heard.
I don't see
Anyone?
any hands raised.
Okay. All right. Well, then I'll close the public hearing and ask the board what's its pleasure.
Make a motion to approve Kaleidoscope Tattoo on Bourbon Street for permit to operate a tattoo establishment.
I second.
All right. Thank you for the second. Any discussion on the motion? No, hearing none, call for a vote. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. All right. Congratulations, Sean. Good luck and welcome to Peabody.
Thank you very much. I'll do my best. I guarantee you that.
Very well.
Thanks, sir.
Thank
Okay.
you. Thank you for everybody's time.
The next hearing is scheduled for 4:20. Why don't I open that one? Okay. The Peabody Board of Health will conduct a virtual public hearing on Thursday, January 27th, 2022 at 4:20, that's just about now, to review and vote on the application to permit to perform body tattooing as an apprentice only. This was submitted by Jessica Helgeson. Jessica, are you here? I see your tile. We'll give you a minute to get situated. Jessica, I see the mute.
Yes.
It
Yes,
has
I'm here.
gone. Yeah, very good. Welcome.
Yeah. Thank you.
Thank you for joining us. At the beginning of these hearings, I like to give you an opportunity to tell us a little bit about yourself or about why you're applying and what you plan to do.
Sure. I currently work as a massage therapist and esthetician. I've been doing massage for almost 20 years, and I've been an esthetician for about 16. And sort of over the course of, working in various spa settings and stuff, I, kind of became more fascinated with the permanent makeup side of things. And I took a class in September at Proteology in Peabody, and now I'm have the opportunity to apprentice there with them too. So that's what I'm doing.
All right. Very good. Sharon, can you tell us paperwork all in order for this?
Yes, it is.
All right. Any questions or concerns from the board? No?
Nope.
Okay. All right. You're going to be practicing at Proteology over there on Pulaski Street.
Correct. Yep, in the mill building there.
There are a number of practitioners there, are there?
Yeah, they I think they have 3 or 4 people that work there full time, and then I'll be the third apprentice that'll come on there.
All right. Good luck.
Thank you.
Okay. Well, is there anyone else in the audience who wishes to speak either in favor or opposition to this application? Well, this is a public hearing. We need to give everyone a chance to be heard. Is there anybody?
No hands are raised.
No? Okay. All right. Well, I'll close the public hearing and ask the board what it likes to do.
I make a motion to approve the apprentice body tattooing for Jessica Helgeson.
All right.
I
You heard the
second.
motion. Dr. Julia, second. Thank you for that.
Yes.
Okay. You've heard the motion and the second. Anybody want to make a comment? Sharon?
Yeah, I just want to clarify, this is for micropigmentation only.
Correct.
Okay. All right. Anything further on the motion? No, hearing none, I'll call for a vote. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. Okay. Good luck to you, Jessica.
Thank you very much.
All right. Be well.
You too.
The last of our public hearings was scheduled for 4:30. Why don't I open that public hearing now? The Peabody Board of Health will conduct a virtual public hearing on Thursday, January 27th, 2022 at 4:30 p.m. to review and vote on the application for an animal permit submitted by Mercia Souza to allow for 6 chickens to be kept on the premises at 43 Tracy Street. It is Mercia, and if I'm saying that wrong, correct me. Mercia, are you here?
Okay, yep, let me find.
Just a minute. Hi, I see your tile up, and I see that you're unmuted. Welcome.
Okay. Hi.
Hi. Looks like you're in the car.
Yeah.
All right. Thanks for joining us.
Oh, thank you so much.
could you tell us a little bit about why you'd like to have the chickens and what your plan is?
Quer falar pouco das por que você está mantendo as galinhas lá? Qual é o seu plano? Por que você quer?
Sim.
Em inglês.
Yes. I want keep the chickens in my yard because I like fresh eggs. Just for me and my family.
Okay.
I started in 2007, in 2015, and for 2 years, and I stopped. And last year I started again, but because the pandemic, I go to the city hall for get a permit, and she asked me about animal control for check my yard, everything about the maize. And because of the pandemic, I'm not back. But I was just two chicken. I think it's no big problem. But now I start to get a permit.
Okay. Marissa, you're planning to have just 2 chickens, are you?
Now I have 5.
Okay. All right. And you're asking for up to 6?
Yeah.
Okay. All right. Do any board members have a question? And let me ask you, am I pronouncing your first name right? Marissa?
Pronome certo.
Como?
Mercia.
Mercia Souza.
Marcia, very nice. Okay, thank you. Any
Welcome.
of the board members have a question for Marcia? Any questions? No? Sharon, have we inspected Marcia's house at 43 Tracy?
Yes, so John Yale had gone out to the property, and just to give the board a little bit of background, as Marcia has said, she did have a animal permit in the past, and then she had given it up. And recently we became aware that there were chickens there. We had received a complaint from an abutter who was having some rodent activity and was concerned about the chickens. So John did do an inspection and there were no violations identified. And he did notice that the applicant has pest control in place. There were bait boxes, and she has submitted to us a statement from a pest control company who has inspected her property and found no violations either. So the coop meets all the required setbacks, and John didn't have any concerns about it.
Okay. Marcia, you know, we have a concern about rodents, rats in particular. And we want to be sure that you're being careful to not exacerbate, make that problem any worse than it is, okay?
Yes.
Okay. All right, why don't I now ask if there are any other people who wish to speak either in favor or opposition to this? This is a public hearing. It's a chance for everyone to be heard. We want to be sure we're giving a chance to everyone. You can use the raise your hand feature. Is there anyone who wishes to be heard on this? This is for the 6 chickens at 43 Tracy.
I don't see any hands raised.
Okay. Well, if there's nothing else, I'll close the public hearing and ask what the board wishes to do.
I make a motion to approve the permit for the chickens at 43 Tracy Street.
All
A
right.
second.
Thank you for the second. All right. We have a motion and a second to approve the application. Is there any other comments from the board? Any further discussion? No? Hearing none, I'll call for a vote. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. Okay, Marcia, you're approved for the 6 chickens.
Oh, thank you so much. I
Yep.
appreciate.
All right, thank you. Be careful with
Thank-
the rodents.
I take care right now.
Obrigado.
Thanks. Bye.
Bye. All right, that dispenses then with the hearings portion of the meeting. We'll go into the business section. The first is the approval of the minutes for December 16th. Can I have a motion for approval?
A motion to approve the minutes from the last month's meeting.
Thank you, Chief Tony. Dr.
I
Julia
second.
seconds that. All right. Any discussion, any edits or comments? No, nothing material. Okay. Let me just call for a vote then. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. Sharon, can I ask, what about the minutes for December 22nd? Those were included in our package.
Yeah, I had forgotten to add those to the agenda, but you do have them, so I think it's okay to vote on them if, or discuss if we need any changes to them.
Yeah. Is the board comfortable with approving those minutes as well? They were part of that Wednesday email that we received.
Yes.
All right, then. Right.
I have no issue with approving. Make a motion to approve December's meeting minutes as well.
Thanks, Chief. Second,
Okay,
Dr.
second.
Julia, thank you. Okay. Any edits or comments on those? No, they were relatively brief, right? It was just that one issue that we dealt with as a special meeting. Okay. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. Those minutes of December 22nd are also approved. We'll move on to item number 2. This is an update on COVID-19 response actions. Sharon, you want to lead us through that?
Sure. Just give me a minute to bring up the data presentation.
Sure.
Okay. Are you able to see the data now, or is it still the old share?
I still see the agenda.
Okay. Okay. How about now?
Yes.
Okay. So I won't go through all of these slides. As you know, this is our data report that we put up on the city website every week. Usually it's data that we get. The local data is data we pull every Monday, but this state data that's included in this report is usually from the prior Thursday because the state updates their data every week at Thursday at 5 p.m. There's actually another state update that will be released in just a few minutes. So these numbers don't reflect the most current state data. But as of yesterday, Peabody actually has had 15,000 cases of COVID, 379 deaths. We've had 12,201 people who've recovered, and that leaves us with about 2,420 active cases. One of the things I want to point out, and I think everybody understands this, but I think it's important to say it, particularly in the recent month or a little bit longer of the pandemic, is these numbers, especially the case count, are going to significantly undercount the true prevalence of illness in our community because so many people now are using home tests, and those cases are not being reported to us. People are identifying themselves as being sick, and they're taking the appropriate steps to isolate and to notify their close contacts. So we no longer have as full a picture of the true burden of disease in our community as we've had in the past. But these numbers I'm sharing with you are kind of the official numbers. So let me go to the next slide. So this is the picture of, just the daily confirmed cases by date. And you can see that, we've had quite a significant third peak of cases that we are still in. We are starting to see a decline in cases, but you can see that the numbers are very high, higher than they've basically been at any point in the pandemic. And this is a little bit of a shorter time frame. This just goes from January 1st of 2021. So this is really the last year. And our numbers are significantly higher than they have been at any other point. One of the key metrics we look at is the 14-day incidence rate. And on the left is Peabody and on the right is Massachusetts. You can see the trends are similar, but our actual numbers in Peabody are higher proportionally than in the state. And so basically this gives you the average number of new cases we see every day per 100,000 population. So it's a way of standardizing cases across different size communities. And again, you can see that our incidence rate has been much higher, orders of magnitude higher than certainly within the past year. And in the last week, we've started to go down, which is very encouraging, but even the downward trend is still very high. Last week's 14-day average incidence rate was 279.8 new cases every day. And again, that's per 100,000 population. So with Peabody being about 55,000 people, that means we've been averaging about 154 new cases every day over the past 2 weeks. This is the 7-day incidence rate, which shows the drops a little bit more quickly. And again, you can see we've made a significant drop over the last week, but again, we're still at a level that's much higher than we have been for over the past year. An average of 130 new cases per day per 100,000 people. So again, in the city of Peabody, that translates to about 72 new cases a day. One of the other metrics we look at and the state looks at is the percent positivity rate, the percentage of tests that come back positive. And again, the Peabody's in blue, the state of Massachusetts is here in orange, and our trends mirror pretty well what's happening at the state, even though Peabody's a little bit higher. Our most recent period, the percent positivity rate was 21.48% of all tests were coming back positive. At one point in time, earlier on in the pandemic, when the state was, doing the color-coded maps, they were looking at positivity rates about 4% as being a level of concern. At one point, they were looking at over 10% as being a level of concern. We're currently at 20.61. So again, we've decreased a little bit from the prior reporting period, but we're still very high. The largest proportion of our cases at this point in time are in our child population. 21% of all the cases in Peabody over the course of the pandemic are in that sector of our population. And fortunately, as we all know, for the most part, children have been spared severe illness, but they are still driving transmission in our community, and they are affecting other sectors of our community. Let me just show you what the deaths look like in our community. The highest proportion of deaths have been in our older population, and that is also very reflective of what's been happening across the state. But again, I'll point out we have had deaths in every age group in our community. To show you where we are with vaccinations, these are the numbers for the different age groups, but our community-wide rates, we've had 80% of our population has received at least one dose, and 72% of our population have received their initial primary series of 2 doses, or 1 dose of the Johnson & Johnson, and about 35% of our population has been boosted. We still have some significant work to do with our 5 to 11 population, and some of our younger age groups as well. So we are continuing to promote the importance of vaccination. We continue to see some gaps in vaccination among different ethnic groups in our community. So again, we are trying to make sure that we distribute information in the languages that are primarily relevant here in Peabody. So that is just a brief snapshot of the local data. I did want to show some of the statewide data as well. Let me just stop the share, and I will show you some other data points that I think are relevant. This is a snapshot of what we've been seeing in our public schools from week to week in terms of cases among students and staff. And again, you can see right after the holidays, we had a very significant increase in the number of cases. And again, we are seeing a downward trend, and that's really encouraging, but it's still pretty high, and it still also doesn't reflect all of the home testing that is being done, and it is not being reported to us. So these numbers are probably much higher than what we're seeing here. Okay. Whoops, excuse me. One of the other pieces of information I wanted to share, because I do think it's particularly relevant to the discussion you'll be having about the mask mandate is what's going on with the hospitals in our state and in our region. And as you know, when you were deliberating on the mask mandate, we had reported that we had been contacted by some of the leaders of hospitals in our region, expressing their concern about the capacity of our hospital system to absorb additional cases, not just COVID-related cases, but to provide care to people who have other medical needs in our communities. And they really made the point that even though many people are experiencing mild illness from the Omicron variant, the sheer number of people being infected, because it's so much more transmissible, has meant that it's placed a significant burden on our healthcare system. So this is what things look like. And again, this was last week's data dashboard from the state. And you can see that the number of hospitalizations, this is the average number of people in the COVID patients in the hospital. We have turned the corner and starting to see a downward decline, but we are still at a very high level. When you look at the occupancy, well, actually, we'll look at this one. Oops. All right, sorry, let me go back to the dashboard. Okay, so this graph shows the top one is the number of ICU patients. And again, you can see that not as high as the first peak of the pandemic and even the second peak, but still significantly higher than it's been in a while, even though we are starting to move in the right direction. The bottom graph shows the number of patients intubated. So again, you know, we are in another surge period, starting to move in the right direction, but still fairly high. The issue that the hospital leaders have raised with us is their concerns about capacity and bed occupancy. So this graph shows what that metric looks like. Let me just get my notes here. So in Northeastern Massachusetts, we had, oh, they have updated the data dashboard. Okay. 1.3% of all the medical surgical beds are currently available. And 8.7% of the ICU beds are available. So even though there is a little bit more capacity statewide, 15.1% of ICU beds available statewide and about 7% of med-surg beds, most of that capacity has been out in Western Mass. When you look at our region, our capacity is much more limited. So that is one of the reasons why we have been requested to take public health interventions to help our hospital systems maintain capacity for patients who need it, not just COVID patients, but patients with any medical need. Stop it here. That's not the one. Okay. Yeah, I think that was all the data I wanted to share at the moment. There may be additional data that I'll share when you have your discussion, but I think I'll stop there to see if you have any questions.
Any questions for Sharon? No. No, the data is very helpful. Thank you, Sharon. Yeah, okay. Is there anything about vaccines that you'd like to update us on?
Yes, so in terms of vaccination, we actually ran a couple of booster clinics this month. We had our a booster clinic yesterday. We're starting to see much less demand for boosters. We've also been able to partner with Mass General Brigham, and they are now going to be in Peabody every Wednesday offering vaccines at the Peabody Institute Library. So they're offering Pfizer, J&J, and they're able to provide first doses, second doses, and booster doses. So they have, much more ability to meet that need. And so with them in place every Wednesday, and they've committed to that certainly through the winter months into the spring, and then possibly beyond that if there continues to be unmet need. So they'll be there every week. And we feel like that will meet the need for vaccination in our community. We have wrapped up all of our in-school vaccination clinics. We are working with the community health center, Peabody Family Health Center on Foster Street, to try to go into the schools and do another sweep for parents who may have changed their minds about having their children vaccinated. So we will continue to have a presence in the schools. In terms of testing opportunities, we're really happy that we were able to partner with Curative Health and with the Analogic Corporation to bring 2 testing sites into Peabody. As you know, the state has sponsored some Stop the Spread sites in local communities, but the closest ones to us were in Salem and Lynn. And we now have 2 regular opportunities for Peabody residents to get tested in our community. There is a kiosk right on Railroad Ave, which is downtown. It's walkable for many of our downtown residents. And there is a second site in Centennial Drive, which will be accessible to people who may be commuting and things like that. So they'll be operating Monday through Saturday. And there is no out-of-pocket cost. They will bill insurance for people who have it, and if people don't have insurance, they have funding from the state to offset those costs. So we think it's a really great benefit for the city to have these 2 new options in Peabody for people to seek testing.
Sharon, tell me about the vaccination availability at the library. That's on Wednesday afternoons. Did I read from 3 to 7 p.m.?
Yes.
Do you need to make an appointment?
No, it's all walk up. They actually don't allow you to make appointments. And that has been a convenience for people. We have heard in the past that sometimes people had challenges navigating an online registration system. So theirs is all walk up.
And the lines haven't been too long?
Nope.
Very good. Yeah, that's a wonderful opportunity. Okay. Well, item C is a review of the emergency regulation that we adopted on December 22nd regarding masks in indoor public places. That's when we put the mask mandate in place. I don't know how the board wants to handle this item. I know that I will say that Sharon has forwarded me a number of emails from a number of people, and I've read every one of them, some lengthy, some quite brief. But I want just to say that I appreciate very much the input. It's a chance to hear from everybody, and I keep all of that in mind in my deliberation and in my vote. And I know from the nodding heads that you both do too. Sharon, this isn't a public hearing, but we have had a practice of allowing people who are in attendance who really wanted to tell us something to speak. And while I can't see them, I imagine they can see me and hear me. So let me say this, that I'm going to allow some comments. Let's see if we can't keep it to 1 to 2 minutes. Last time we did this, it went very well. They were thoughtful comments. I'd ask you if you could to not be repetitive. You know, it may feel good to tell us one more time, but just in the sense of being efficient about all of this, we'd ask you not to repeat what's already been said. New information is very welcome. So why don't we start? Is that okay with the board? All right. All right. You're sitting down, are you? This may take a bit. All right. I don't know how many people are there, but we'll give this a try. Sharon, you want to start letting somebody in who has their hand up?
Yep. Danielle has been made a panelist, and you can unmute yourself.
All right, Danielle, welcome. What would you like to tell us?
Hi, are you able to hear me?
Yes.
Okay, hi. I, along with probably some of the other letters that you received, I was disappointed as a mom of 2 young kids to see that the mask mandate was put into, this emergency effect. I do appreciate all of the data just presented by Sharon, and I do, I've read a lot of studies on the helpfulness of masks, and that also disprove masks as a helpful tool, and strategy against COVID. As someone, I work in the public, I work in 2 different gyms in Peabody. I feel as though it's such a polarizing thing, masking, and the people there, we never took the option away from people to mask, and I think the people that wanted to wear them were wearing them straight along. It seemed as though town after town after town decided to bring back masking right as the mainstream media was kind of admitting that cloth masks actually aren't as helpful as they were preaching for the last 2 years, which was very frustrating to hear. I think a lot of people can speak to just the, they say, oh, the science is changing. I understand that. And I think if the powers that be on this level, on like a local level and, the national level, the worldwide level, everyone would just kind of say, we don't really have all the answers, or we once in a while say, we got it wrong. I think we'd be so much more lenient about it, about hearing this information. If someone would just say, okay, we were presented with another view, or maybe we got it wrong. It's just to keep getting this, the changing information. This is what you have to do. This is what you have to do. This is, if you don't do it, you're just morally reprehensible. And then all of a sudden, 2 years later, oh, actually, that wasn't really as helpful as we once thought it was. And it just gets dropped like so casually. The rules change, the science changes. It's very frustrating on our level. And it seems like the virus does what the virus wants to do in spite of this. And it's frustrating to be on that end of it too. I understand as people in charge, you feel the need to take some sort of action. This isn't it. This really, it's not it. The virus is doing what it wants to do regardless of masks. I don't wear a mask everywhere I go, even when there is a mandate in place. And it's not to be blatantly disrespectful. I'm certainly not like a troublemaker by any means. People don't say anything. I think they know that we've just had enough. They know that we're all over it. We've all had enough. And as far as the kids go, I mean, I'm a licensed educator. I have my degree in teaching. Childhood Development 101. Kids need to see faces. I have a child who has a medical mask exemption for severe anxiety. We tried it last year. She was hyperventilating. She wasn't able to eat. She almost passed out a couple of times from just having a panic attack under her mask. And even with a medical note, her principal at St. John's disregards that in favor of the science. And I say that with air quotes. It needs to end. It really does. I've spoken with many parents who are on the same page, and there are parents who will continue to mask their kids, and they have that right. But please, we want to be left alone. We know the risks. We know everything that you guys know. I'm reading all the data too. I'm doing my own research. We just want to be able to make our own decisions. Thank you.
All right. Your comments sound familiar. Did you write a letter? Were you one of the many?
I did.
Yes, it sounded very familiar. Thank you for your letter and your comments tonight.
I appreciate the time. Thank you.
All right. Thank you. Do we have others raising their hands? Okay.
Yep, I just added Ellen to the meeting.
All right. We'll let Ellen get situated. Welcome, Ellen. I still see the mute icon there. We'll let you get settled in.
Can you hear me?
Yes, welcome. Thanks for joining us. What would you like to tell us?
Thank you for having me. And I promise I won't reiterate what Danielle just said, but I'd like to piggyback on it. She was saying everything I may have submitted in my own letter. And I'm a member of a facility in Peabody and have not returned since Peabody issued the mask mandate. And I will never exercise with the mask on. And so if this continues, I'll have to give up my membership, which is revenue loss for the facility. I also don't shop where I have to wear a mask, whether it's Peabody or another community. I find areas that I don't have to wear a mask. And this needs to end. Like she said, we all know our risk. We've all done the right thing. We've been vaccinated. We keep our distance. We have great hygiene now. And it's just time to move on. And that's what I'd like to submit.
All right, Ellen, thank you for your comments. We'll consider those.
Thank you.
Thanks. All right, Sharon, I'll leave it to you.
If anybody would like to speak, please raise your hand. Okay, hold on.
Yep.
Okay, I've just admitted Beth Amico to the room.
All right. Yeah, I see Beth's tile. I'll give her just a minute. Hi, Beth. Welcome to the meeting.
Hi, thank you so much for having me and all of us, of course. I just wanted to come on briefly. I know that you have received a letter on behalf of the Peabody Area Chamber of Commerce, and I just wanted to say a couple of things. First, thank you to the Board of Health and to Sharon Cameron, and I commend you, and I know I speak for the members as well. When we say thank you, and I also want to speak on behalf of the members, just given the information that we received. It was just a handful of responses when we did put a brief survey out to our members to just say, hey, how is it going right now? And what is there? Is there anything that we can do in regards to helping, whether it be for advocating for you, getting more information for you somehow, and knowing that Sharon and the board would be there to provide that information for us. And you are here to do that. And the data certainly that Sharon went through, it is great to see that there is some improvement and some decline in the numbers. And that's certainly a positive, great thing to see and to hear about. And I just, in regards to the letter that we submitted, would just reiterate that, I think, and Sharon and I emailed at one point too, to say that there's that balance of ensuring businesses stay safe, but are successful. And that's a tough weight. And I understand that. I can appreciate it and I respect it. And I also know that there is a lot of different opinions that are out there, and I can respect those as well. And I just wanted to come on to say that I appreciate you allowing us to submit our letter and the fact that you read through it. And I just want to speak on behalf of businesses that I did hear back from, is that the more information and the more communication that the city and the board has with our businesses, the better. The more information that they have and they're equipped with to then share with their guests, their customers, their clients, and their families. And it's such a huge circle that's affected. And we all know that already, of course, given that, business equals a family's income. And we just want to ensure that everyone is safe. And I know that that's not an easy equation and answer, to come to, but just to ensure that businesses are taken into consideration, as I know they have been, and it's not an easy decision to be made, but just so that they are included, as you're allowing right now, Tom, for people to come on and give their feedback and how they're being affected personally and professionally, is wonderful and appreciated. And I also want to say that have to give kudos certainly to my 16-year-old daughter got her booster at the library. last night. So, and the process was seamless and the walk-up process was great. And so I just thought I would share that information as well. So thank you again. And from, on behalf of the Peabody Area Chamber, we appreciate you allowing us to submit our letter with some feedback from our businesses as well. So thank you.
Thank you, Beth. The interests and the concerns of the chamber are very important to us, and we appreciate the letter that you sent and your comments tonight. And you probably sat through half the meeting just to be able to get on for a minute or two, and we really appreciate that. And please thank the people at the chamber for their leadership in the business community and the community as a whole in Peabody. It's a very important part of our community, so thank you.
Thank you so much.
Okay. Maybe Beth's daughter was able to take out an interesting book while she was there.
If anybody would like to be heard, please raise your hand.
I don't know if the library is open until 7. Is the library open until 7 on Wednesday nights?
It is, yep.
It is. Very good.
Yep. I've admitted Andrew O'Donnell to the room.
Okay. Welcome, Andrew. Thank you for joining us.
Good afternoon. Thank you very much for having me.
What would you like to tell us?
I'll stay brief. I have the pleasure of serving the Peabody community here in the North Shore, and there is no real refuting what Sharon said in terms of the data. I can completely respect that. COVID-19 has impacted all of us so significantly in a health and mental health point of view. I just want to offer the additional point of view as well of cardiovascular health, obviously serving at a fitness facility here in the North Shore in Peabody, cardiovascular health and mental health, and the impact that a health and wellness facility does do in some very major players in terms of people's overall health. It breaks my heart to hear stories like Ellen's. It's a story that I've heard several times, that with a mask mandate, either it be the restrictive of anxiety or asthma or things of that nature that have limited people's ability to engage in their health and wellness, and has caused other pandemics and other issues in terms of overall health. So like I said, there's no refuting what Sharon said in terms of the overall data, but I would like this council to consider also the other impacts of health and wellness that are being affected by a mask mandate remaining in place.
All right, Andrew, thank you. Are you calling from Lifetime Fitness?
I am, yes.
Yeah, that's quite a facility. We wish you well with that.
Thank you very much.
Yeah. We'll consider those comments. Thanks again.
Okay, I have admitted Ekaterina to the room.
Oh, maybe I should have.
Welcome, Ekaterina. We can see you and hear you.
Hello, hi. I have comments about the mask mandates as well. So I have a health condition. It's anemia, basically low hemoglobin. So when I wear a mask, I don't get enough oxygen, and it really affects my brain. And I'm pretty healthy besides that. I work out a lot, I run, and I love to go to gym, but I had to cancel my membership because of that mask mandate. And I don't like to go to stores when people ask me to wear a mask, and it feels harassing to me, actually. And I try to explain that I have a health condition. Some people understand and let me shop. Others stare at me and they ask me to leave, and I feel discrimination. It's really concerning. And I would want to go back to my gym. I would like to shop and walk around without people staring at me like I'm a somehow threat to them. I'm a healthy person besides my anemia, and I would like you to reconsider that mask mandates. That's the only thing I wanted to tell.
All right. Yep. Thank you for your comments. Thanks for joining us tonight.
Thank you.
All right. We wish you well.
Thank you. Bye-bye.
Bye.
If anybody else would like to speak, please raise your hand.
You know, I'll just say before the next person, if there is a next person, how appreciative we are that everybody's just so civil and reasonable. It's very much appreciated. I think we're fortunate.
Anybody else would, if you'd like to speak, please raise your hand. Okay,
They're clearly thoughtful people. Okay, so all right. The sense is we can end it there.
Nobody else has raised their hand, so.
Okay, all right. Well, why don't we continue then? You know, we made a promise, board members, I think last time at our special meeting on the 22nd, that we would be data-driven and timely about our reconsideration of the mask mandate. So I think we're meeting that commitment. And I wonder what the feelings are of the other board members. What do you think? Dr. Julia, did you want to say something?
So I can certainly appreciate, especially the point from the Peabody Chamber of Commerce, the need for metrics in terms of when we can expect to, you know, what metrics we're using in terms of continuing the mask mandate. And one thing that we hadn't discussed yet was the wastewater data that you was it you, Tom, who had
the Mass Water Resources Authority has joined with a private company called BioBot to provide a sample of the wastewater quite frequently, nearly every day. And BioBot has been able to, with their science, been able to identify the RNA in the wastewater. And it has been, over the nearly 2 years now, a pretty strong predictor, about 5 to 7 days, of what the hospitals are likely to see. That was the intention of it. And it's been, I think, a good service to the community. Massachusetts has gotten some national recognition, but, you know, not a lot of heavy lifting from my employer. We just provide, you know, a jar full of the wastewater. It's the brilliant scientists at MIT and elsewhere that were able to come up with this. And it did show early on the spiking from the Omicron variant that we were seeing, and it has been coming down, thankfully. I don't know if it's come down, and I don't know if all of these other data points have come down to a point where you're all comfortable with releasing the mandate, but that's what we should be discussing.
Yes. So I was actually really I was happy to see the wastewater data, the significant decrease in that, and I do think that it's a predictor of where we're going in terms of cases, which is exciting. But I think at this point, especially with a percent positive, you know, in the double digits, and that being significantly lower given all the testing that's going on at home, I think it's probably too early to rescind the mask mandate at this time. I don't think we're that far off. You know, I don't think it's going to be very much longer, but I think we need to wait a little bit longer until the percent positive goes down. And I think that there's a little bit more wiggle room in the hospitalizations.
All right, Doctor. Chief Tony, did you want to weigh in?
No, I was, what the doctor said, I agree with. And I know we did when we voted on this, we said we would take it month by month, and I feel strongly with doing that. I love seeing the numbers go in a different direction like that. The wastewater, again, was great information. really help us, and hopefully we can continue to get that information moving forward. But I think that, again, revisiting this in February and hoping that we're on that right trend to see these keep decreasing. But as of right now, I don't know if I would feel comfortable rescinding that mandate.
Okay. Sharon, something you wanted to say? Did you have your hand?
I did. I thought, let me see if I can find the share I wanted to. Okay, so are you guys able to see this modeling?
The daily deaths modeling.
Yes, and I
Yes.
thought this is a really well-respected source. It's from the University of Washington Medical School. They have an Institute for Health Metrics and Evaluation, and they did modeling of daily deaths, and they did it with 3 scenarios, projected with the track we're on now, projected if we increase mask usage to 80%, and then projected if everybody, 100% of those who are vaccinated get their 3rd dose. I'm going to eliminate that one from the screen just because we're not really discussing that one. And what it shows is that the purple line is the trajectory we're on if nothing changes. And this is across the whole country, so it certainly doesn't reflect local conditions. But we have the highest level of transmission that you can possibly have under the national metrics. And then the projection is the green line of if we were able to increase mask use up to 80% of the population. And I just picked March 1st as a data point. And if we, it doesn't really look, you can see that there's a different trajectory with the mask use, and it's actually a 28% decline in cases by March 1st. If you were to, have 80% mask use, which is, as close to a universal mandate as you'd probably get in terms of compliance, the average daily deaths would decrease from about 193 a day to 138 a day. And that's a 28% decline. And I think that's significant. So I do think it's appropriate for you to be considering that at this point. And the other things I wanted to just point out is that the American Academy of Pediatrics strongly recommends that anyone over age 2, regardless of their vaccination status, wear a well-fitting face mask when they're in public. And the CDC recommends the same. So I think those are really, I have heard from people, some of the folks who've sent us correspondence over the past week or so, people have linked to different, YouTube videos and, from people who are, have exercise backgrounds and nutrition backgrounds and things like that. I think there are a lot of different scientists, but the ones that public health officials rely on for public health guidance is the CDC. They have the expertise in infection control. They have epidemiologists who study spread of disease, and their recommendation is for masking regardless of vaccination status when we're in areas of either substantial or high transmission. And we do have high transmission at this current time. I do agree with Dr. Fleet. I think we are closer to getting to a point where I think we all desire to be, which is not to have this as a mandate, but I don't feel like we're there yet.
Okay, thank you for that. I'll say that I'm very sensitive to the comments I heard and to the struggles that some people and their children are going through. I truly am. And I don't want to in any way minimize that because it's real. I'm convinced of it. And it's really unfortunate. And I do commiserate with some of those comments about it needs to end, it's time to end. I really wish it too. From the bottom of my heart, I truly do. But I think we've got a responsibility to watch these numbers, watch the data, and to continue our commitment to keep an eye on this, to be open to the comments as we have been. But I'll make it unanimous and say, I just don't think we're ready. I was hopeful, I truly was, back in December 22nd, that at this meeting, we would have had enough, nearly a month, and it would have been enough. We're not quite there in my judgment. So I would advocate for leaving the mandate in place and to watch it carefully for our next meeting. And I'm even willing, I think, if the other board members are, to pick a Thursday a little earlier in the month, not maybe the last Thursday, as just one more sign to the community that we're taking their comments seriously, that we're going to watch this. And maybe, I'm looking at this graph, maybe by then in February, maybe it'll be time. I'm hopeful. That's all. It's difficult. People don't like wearing masks. I understand it. Okay. Go ahead, Sharon.
We did have Ekaterina had raised her hand again, so I put her back in the meeting room.
Okay. Ekaterina, is there something else you'd like to add?
Yes, thank you for giving me a chance to speak again. So I really appreciate the data, and about that graph you said 80% compliance will increase the, how do I say, like health implications will go down and stuff, and it will lessen the transmission. But in my opinion, as I walk around and I see people, there is like almost 100% compliance already. So is there really a reason to wait? Like there's already 100%, almost 100% compliance with masks wearing indoors. Why do we have to wait until like, I don't know, 80% or something? And then again, it's like you said, children from 2 and up have to wear masks, but we like have to consider other health implications for them. They don't see our smiles. I have a child, he's gonna be 3 in March. And he really doesn't like me to wear a mask. He wants to see me smiling. He wants to see what I say. He doesn't understand why should I wear a mask. And I believe that other children want to see their parents' faces and their teachers' faces and their friends' faces. This is kind of like, we gotta consider other health implications, not only that virus transmission, especially for children. It's like, it doesn't apply for them, it seems. There's a lot of data and information that children don't get sick really with COVID. Maybe we should like consider that for them. Thank you.
Okay, thanks again. Thank you. We'll consider that. Yep. It nearly breaks my heart, parents advocating for their children, sincerely like that. Sharon, you've told us a number of times, it's the pediatricians, it's the epidemiologists, it's the CDC, that we use as our foundation, right, for guidance. And I think that I feel somewhat bound to that, just to be prudent and to discharge the duties that we promised the council and the citizens of Peabody we would, notwithstanding her comments. Okay. Is there anything further to say on this matter? We'll leave it until the next meeting. Okay. All right. Why don't we move through the agenda then? Item E is changes to contact tracing protocols. Do you want to update us on that issue, Sharon?
Sure. And there's also, you're probably aware, the state has changed their isolation and quarantine guidance to make them less onerous. And again, this is one area where they have used what's been learned about the disease to make modifications to their recommendations. So now, instead of isolating for 10 full days, most people would have the ability to remove from isolation after 5 days, assuming their symptoms had improved and they've been fever-free. they still do have to continue to wear a mask when they're around other people for an additional 5 days. And that includes mask use in places where normally they wouldn't be wearing a mask, for instance, in their own homes and outdoors and things like that. So those recommendations have changed, and they've also changed the quarantining recommendations for people. Again, if you're not exempt because you're fully vaccinated and boosted, you only have to do the 5 days quarantine if you have not become symptomatic or tested positive. And again, strict mask use for the additional 5 days after that. So we've been fielding a lot of questions about that. In addition, though, one of the more significant changes that has happened over the past week is that the state has introduced a new protocol for schools, and also kind of some similar options for daycares to allow people to forego traditional contact tracing and really move to a model, particularly in the schools. The daycares are a little bit different. They're moving to a test and stay model, but in the public schools, if your community opts in, which Peabody has opted in, they will be receiving at-home test kits, which would be distributed to any staff and any students who have opted into the program. And then they would be doing routine testing themselves on a weekly basis, or if they were to become symptomatic or had an exposure they were aware of. So it's going to eliminate the test and stay program, which has been very successful in our schools. It's also going to lift some of the requirements, and frankly, most of the requirements for doing contact tracing in the schools. It does give us the option at the local Board of Health level to continue to contact trace if we think there's a cluster, for instance, a significant exposure among members of a sports team or a school club or in a particular classroom. But for the most part, we'll no longer be doing close contact notification. So if your child's classmate or lunch room companion tested positive, you're no longer going to be getting notified from the school that you've had that exposure. It's moving to a model of personal responsibility where people are supposed to be notifying their own close contacts, and those close contacts should be appropriately quarantining and monitoring themselves. So we are moving to a kind of a phase of the pandemic where people are taking more responsibility for doing the right thing. We think people do understand the guidance and the importance of people needing to stay home when they're not well or if they've had an exposure, and that people will take that responsibility on themselves. So that's a significant change.
All right. Thank you for that. We'll move on to item 3. These are the environmental updates. We recently got an update on Rousselot. That's the first one. Is there anything you can tell us about that, Sharon?
Nothing significant. We have had 3 complaints over the course of the last month, but we continue to respond to, reach out to Rousselot, and they continue to be responsive in terms of investigating and getting back to us with information about what they have attributed the source of odor to, and continue to make operational adjustments. So I don't think there's anything significant at this time of year. We traditionally don't get a lot of complaints anyway, just due to the weather patterns, but it's something we continue to monitor every month.
Okay. We got a document, did we, about Northeast Nursery? You have an update for us on that?
They submit a quarterly report to us on their efforts to prevent nuisance odors and nuisance dust and noise in their neighborhood. So this is just a routine update.
Yep. And then we have Brown and Caldwell's update on the ash monofill. That's routine, isn't it?
Yep.
Nothing concerning in that report.
Nope.
Okay, we'll move on to code enforcement updates. These are rather routine. Items A through D. Is there anything particular you wanted to bring to our attention?
No.
Okay. All right. And the board members, you've all gotten your permit updates. It's always fascinating to be reminded what permits we've issued. And then item 6 is the public health nursing updates. We have Chessie's update and some statistics. Anything concerning in there?
No.
No, she does a nice job of sort of putting us at ease when I see something, I read her comments. Oh, okay, she's followed up on that. That's always reassuring. I want to be sure I'm not passing over anything. We have grant updates, the interface, that seems to be going okay. Is it, Sharon?
It's not getting as much usage as we would like. We definitely need to make sure more people are aware of that resource to connect them to mental health providers. We did get a notice from Interface yesterday that because of the increasing need for mental health services and, providers implementing restrictions on, how many patients they'll see, that they are having a bit of a challenge to connect people with providers as quickly as they have in the past. So they've actually put a pause on new intakes for a period of 3 weeks. This is the first time I've known them to do that since we've been under contract with them. But once they resume intakes, we'll try to publicize this more so that people are aware of this resource.
Do you, or Dr. Julia or Chief Tony, do you sense that mental health issues and the difficulty there has been exacerbated by the COVID pandemic? We're seeing more of that, aren't we?
I would say so. From my prior career, we saw definitely an increase in the number of medical calls we were doing during the pandemic for mental illness emergency response. So I would say, I would venture to guess to say that this has exacerbated it.
Yeah, we see it at my work. I see it in my personal life. People are short. I know that doesn't necessarily indicate a mental health issue, but if I'm seeing one tail, of a distribution, there's got to be some people who are really challenged. This is a good resource. I hope it's successful. Okay. Coming to the last item then is the correspondence. We have some correspondence from the DEP. Nothing unusual there or worth commenting, Sharon?
No.
Okay. Well, that brings us to the end of the agenda. Is there anything else that we want to bring up, Sharon?
Yeah, there is one item that was brought to my attention. We had early on in the pandemic, I believe it was last April of 2020. Yes, April 2nd of 2020. The Board of Health had issued an emergency order establishing a moratorium on eviction enforcement. That order was superseded when the state issued a similar order. And so we kind of, didn't take any action on our local order, but the state order has now lapsed. And the question has arisen, is our local order still in effect? And it's my understanding that, we allowed ours to sunset, but there's actually not really language in the order that's clear about that. So I do think it would be appropriate for us to formally acknowledge that this local order has been sunsetted.
Okay. No particular language, just to acknowledge the sunset of that order back in April 20th of 2020.
Yeah.
Okay.
And I don't know if you feel comfortable taking that action today or if you want to see that on the next agenda.
My expectation had been that we were in alignment with the state, and I didn't know if any extra action was necessary. But if you think it clarifies the record and clarifies what our intention is, I'm happy to make it part of the record if the other board members are. Yeah.
Yeah, I have no problem with that.
All right, Chief, you want the record to reflect your motion then to acknowledge the sunsetting of the order of April 20th? Okay.
I'll make a motion to sunset the eviction notice, the emergency order eviction notice from April 2020 that we put in place.
Okay.
And I second.
Thank you, Doctor. Okay. All right. Any further discussion on that? Nope, that should be enough. All right. All those in favor say aye. Aye.
Aye.
Opposed, no. The ayes have it. Okay. That sets the record clear. Anything else? Any board members have any issues to bring up? Anything else? No? You want to set a next meeting date?
Sure.
All right. So we're looking sometime in February. Is the 17th a good day for everyone? These Thursday afternoons seem to work best.
Yeah, 17 works good for me.
All right, Dr. Julia, what do you think?
Yes, that sounds good. Thank you.
Great, okay. All right, Sharon, you want to do it 4 o'clock, the 17th of February?
Sure. And do you want it to be a fully remote meeting or do you want an in-person option as well?
I don't know, what does the board think? If you think the business is getting done okay virtually, I'm happy to continue that way.
Yeah, I have no
mind coming
problem
in.
either way.
All right, I don't mind coming
That's
into
fine.
City Hall. We can continue virtual. What do you think? One more month?
Sure, sure.
Okay.
Sure.
All right, one more month, Sharon.
Okay.
All right, well, very good. Thank you, board members. Thanks, Sharon. Lucky to have you, Sharon. Thank you.
Yeah, thank
thanks.
you. I'm lucky to have
Okay.
such a knowledgeable board. I really appreciate all the work you guys do to prepare for these meetings and your thoughtful comments.
All right, well, thank you.
I appreciated the public participation tonight too. It was great. It really was. We'd like to hear back from these folks, so.
Yeah, I know
Motion
they must
to
be
adjourn?
disappointed. They must be
Yeah.
disappointed, but hang in there. You know, we're listening and giving it serious consideration. The comments are important. All right, well, good night, everyone.
Good night.
Okay, thanks. Bye.